The deltoid muscles. The deltoid muscles. Delta, triangle, oid, shape or form, deltoid. The anterior deltoid comes from the clavicle, goes on to the deltoid tuberosity at the humerus. Anterior deltoid, flexion at the shoulder and medial rotation, as well as doing abduction in combination with the other deltoid muscles. The middle or the lateral deltoid comes from the acromion process and then goes on to the deltoid tuberosity. The lateral, the middle deltoid, abduction. And the posterior deltoid. So this comes from the spine of the scapula. It's quite a big muscle. Spine of the scapula again to the deltoid tuberosity. So this one will do extension at the shoulder, the glenohumeral joint, and lateral rotation. And in combination with the other deltoid muscles, it will do abduction. Posterior deltoid and the middle, the lateral. Is the scapula. There is the spine of the scapula, the medial border of the scapula. Above the spine of the scapula is supraspinatus, superior, above the spine of the scapula. It initiates abduction at the glenohumeral joint, so abduction of the arm. It will lift the arm out to the side. Below the spine of the scapula is infraspinatus. Infraspinatus will do lateral rotation at the glenohumeral joint. A small muscle just underneath infraspinatus is teres minor. Teres minor also will assist to do lateral rotation at the glenohumeral joint. This muscle is teres major. Some people will include that in the rotator cuff muscles, other people will not include that. Teres major goes around to the front of the humerus, the anterior part of the humerus, close to the bicipital groove. Supraspinatus, infraspinatus, teres minor, teres major, and underneath the scapula is subscapularis, and subscapularis is the major medial rotator at the glenohumeral joint. Rotator cuff muscles for some people, supraspinatus, infraspinatus, teres minor and subscapularis. For others, supraspinatus, infraspinatus, teres minor and teres major and subscapularis. Rhomboids will do adduction, so they'll bring the scapula closer towards the vertebral column, and because of the direction they will also do some elevation. They will lift the scapula up as well. Sternum. In this diagram, pectoralis major has been cut away, both the clavicular and the sternal sections, to expose pectoralis minor. Pectoralis minor comes process and goes towards 3, 4 and 5. So there are 3 muscles that attach to the coracoid process: pectoralis minor, coracobrachialis, and the short head of the biceps. Pectoralis minor will do protraction. It will roll the scapula forward. Pectoralis minor. Serratus anterior. Serratus anterior is the jagged edge, serrated edge. Goes all the way up to rib 1, wraps around the ribs and attaches onto the anterior surface of the scapula, the medial border. Serratus anterior. Same muscle there, goes right up to rib 1, wraps around the ribs, so it comes between the ribs and the anterior surface of the scapula onto the medial border. Its primary function is abduction of the scapula. Abduction of the scapula. Serratus anterior.